Welcome back to my channel Mis.Medicine. This is Dr. Garima and this is part 4 of 20th notebook series. If you are new here, subscribe to the channel. Let's start the video. Drug of choice of cirrhotic ascites is spironolactone. NSAIDs induced ulcer, Zollinger-Ellison syndrome, GERD, stress ulcer, peptic ulcer, gastric and duodenal ulcer. Drug of choice PPI. Metastatic GIST. Drug of choice imatinib. First line treatment for unresectable HCC is sorafenib. Second line treatment unresectable hepatocellular carcinoma. Drug of choice regorafenib. Post of vomiting, radiation induced vomiting. Drug of choice ondansetron. Levodopa-induced vomiting, drug of choice domperidone. Migraine or drug-associated vomiting, drug of choice metoclopramide. Opioid-induced constipation, drug of choice methylnaltrexone. Cancer chemotherapy-induced vomiting and early cisplatin-induced vomiting, drug of choice 5-HT3 antagonist. Esophageal spasm, drug of choice nitroglycerin. Morning sickness, drug of choice pyridoxine plus doxylamine. Sclerosing cholangitis, drug of choice glucocorticoids. Diarrhea in carcinoid syndrome, HIV-associated secretory diarrhea, drug of choice octreotide. Mild ulcerative colitis, treatment and maintenance, drug of choice mesalamine and 5-ASA. Moderate colitis, treatment induction 5-ASA plus oral steroids. Moderate colitis, maintenance, drug of choice 5-ASA plus azathioprine. Treatment of choice of refractory ulcerative colitis. This is the recent question. Protectomy with ileal pouch, anal anastomosis. Induction and maintenance of Crohn's disease is anti-TNF drugs. Narcoidosis, drug of choice cotrimoxazole. Severe narcoidosis, drug of choice cotrimoxazole plus amikacin plus imipenem. Actinomyces, rat bite fever, listeria infection and syphilis, drug of choice penicillin. Aspergillosis, drug of choice voriconazole. Anaerobic infection caused by bacteroids, giardiasis, trichomoniasis, amoebiasis, bacterial vaginosis, treatment of pseudomembrane colitis, drug of choice metronidazole. Klebsiella and E. coli, drug of choice meropenem. Next one, histoplasmosis, blastomyces, paracoccidiosis, and coccidioides or coccidiomycosis, drug of choice itraconazole. Next one, scabies, head lice, gnathostomiasis, onchocerciasis in adults and children more than 5 years, human strongyloidiasis, hemoprophylaxis of lymphatic filariasis. Drug of choice ivermectin. Invasive mucormycosis, drug of choice amphotericin B. Treatment of choice for decompensated cirrhosis and hepatitis B infection, tenofovir. First line drug for chronic hepatitis B infection, tenofovir. Lamivudine resistant strains, tenofovir. Chronic hepatitis infection, hepatitis B carrier is pegylated interferon alpha. Pseudomembrane colitis caused by Clostridium difficile and MRSA, drug of choice vancomycin. Invasive candidiasis, cryptococcal meningitis, coccidia meningitis, drug of choice fluconazole. Gold standard for induction prophylaxis of cryptococcal meningitis, amphotericin B. Diphtheria carriers, drug of choice erythromycin. First line prophylactic for prophylaxis for early stage East African trypanosomiasis. First line treatment for the late stage East African trypanosomiasis, drug of choice milarazuprol. Drug of choice for late stage Western African sleeping sickness is nifurtimox and eflornithine. Next one, scrub typhus, drug of choice doxycycline. Scrub typhus in pregnancy, drug of choice azithromycin. Whipworm, Trichuris trichura, hookworm, and Cyclostoma duodenale. Roundworm, Ascariasis lumbricoides, dog tapeworm, and Echinococcus granulosus, drug of choice albendazole. Neurocysticercosis, drug of choice begin with glucocorticoids before albendazole. Sudden diagnosis of neurocysticercosis and patient develops seizures, albendazole. Schistosomiasis, drug of choice praziquantel. Pneumocystic xerovaci pneumonia, drug of choice cotrimoxazole. Prophylactic for prophylaxis in immunocompromised HIV patients, drug of choice cotrimoxazole. Mild to moderate babesiosis, drug of choice azithromycin plus etovaquone. Severe babesiosis, drug of choice azithromycin plus etovaquone. Alternative clindamycin plus quine. Type 1 lepra reaction, drug of choice glucocorticoids, then clofazimine. Severe type lepra 1 reaction, drug of choice glucocorticoids or clofazimine. Chagas disease, drug of choice benzimidazole. Asymptomatic intestinal luminal amoebiasis with E. histolytica, drug of choice paramomycin. Scabies, drug of choice 5% permethrin. Cerebral malaria in pregnancy, drug of choice, quinine. LGV, drug of choice, doxycycline. Cholera in adults, drug of choice, doxycycline. Cholera in children and pregnancy, drug of choice, azithromycin. Cholera chemoprophylaxis, drug of choice, tetracycline. Chickenpox in immunocompromised patients, drug of choice, valcyclovir. Gold standard prophylactic for prophylaxis in immune compromised patients, especially in AIDS for cryptococcal meningitis, drug of choice, amphotericin B plus flucytosine. Next one, tularemia, which is caused by Francisella tularensis, gram-negative bacteria, drug of choice, streptomycin. Severe complicated malaria, drug of choice, artesunate. Drug of choice for pneumocystitis jirovecii, drug of choice, trimethoprim plus sulfamethoxazole. Next one, rhinocerebral zygomycosis, cryptococcal neoformans, severe Candida albicans, drug of choice, amphotericin B. Congenital toxoplasmosis in neonates, drug of choice, pyrimethamine. Congenital toxo in more than 18-week pregnant women, drug of choice, sulfadiazine. Congenital toxo in less than 18-week pregnant women, spiromycin. Salmonella and chemoprophylactic for meningococci, drug of choice, ceftriaxone. Next one is the carcinoid syndrome, vipoma, glucagonoma, somatostatinoma. Drug of choice, somatostatin analogs. Next one is the emergency contraception, drug of choice, levonorgestrel. Postmenopausal osteoporosis, drug of choice, bisphosphonate. Treating the fetus in utero when suspected of having CAH, drug of choice, dexamethasone. Most effective antiemetic for chemotherapy-induced vomiting, granisetron. Drug of choice for hyperthyroidism and drug of choice for thyrotoxicosis in pregnancy is T1-propyl thiouracil. Next one, hyperthyroidism, drug of choice, T2, T3, methimazole. Induced induction of labor and PPH, postpartum hemorrhage, drug of choice, oxytocin. Cervical priming, drug of choice, misoprostol. Hypothyroidism, drug of choice, levothyroxine. Next one is the diabetes mellitus, IDDM, uncontrolled diabetes mellitus and gestational diabetes mellitus and diabetic ketoacidosis, drug of choice, insulin. Next one is the type 2 diabetes mellitus, non-insulin dependent diabetic mellitus, and the diabetes in obese, drug of choice, metformin. Postprandial hyperglycemia, drug of choice, nataglinide. Acute hyperkalemia, drug of choice, calcium gluconate. Adrenal insufficiency, Addison's disease, drug of choice, hydrocortisone. Acromegaly, drug of choice, cabergoline. Hypothyroidism during lactation, drug of choice, propylthiouracil. Hyperprolactinemia, drug of choice, cabergoline. Hypercalcemia of pregnancy and Paget's disease of bone, drug of choice, bisphosphonates. Anovulation, drug of choice, clomiphene citrate. Insulinoma, drug of choice, diazoxide. SIADH, drug of choice, Veptans. Prolactinoma, drug of choice, dopamine agonist. Next one is the Acinetobacter, drug of choice, carbapenem, imipenem, colistin, polymyxin B, and ertapenem. Next one, acromegaly, somatostatin analog, octreotide and lanreotide, pegvistomant. If no response, ADR, pituitary adenoma. Next one, actinomyces, drug of choice, penicillin G, then oral amoxicillin, and then doxycycline. If there is any penicillin allergy. Bleeding gastric ulcer, drug of choice, IV proton pump inhibitors, basic pH promotes coagulation. Next one is the heart failure, drug of choice, dobutamine, dopamine, Lasix. If no reaction, then IV nitroglycerin. If no reaction, then nasiretide. Next one is the mountain sickness, drug of choice, acetazolamide. Dystonia, drug of choice, trihexafenadil or benzaxole. Next is panic attack, drug of choice, benzodiazepines or SSRI. Varicose bleeding, drug of choice, terliplacin or octreotide. Terliplacin is the best treatment and octreotide is a drug of choice. Addison's disease, drug of choice, IV hydrocortisone. Next one is the ADHD, drug of choice, methylphenidate. Adrenal carcinoma, drug of choice, surgery, mitotane and hydrocortisone. Treatment of choice, adrenalytic for 5 years. If adrenal insufficiency, give this. Next one is the akathisia, beta blockers, then anti-acetylcholine and the benzodiazepines. Next one is the allergic bronchopulmonary. Aspergillosis, drug of choice, prednisolone and itraconazole. These are antifungal. Next one, allergic rhinitis, drug of choice, nasal spray, steroids, budesonide, beclomethasone, fluticasone, add antihistamine, azilastine, olapatadine, and for children, nasal cromolyn spray. Next one is the ALL, acute lymphocytic leukemia, drug of choice vincristine, prednisolone, asparaginase. Next is the AML, drug of choice cytarabine. Cytarabine continues IV infusion, cause cerebellar, cerebral toxicity. Next disease, Alzheimer's disease, drug of choice donepezil and memantine. Next one, amoebiasis, intestinal asymptomatic, drug of choice oral paramomycin, diloxanate furoate. Next one is the intestinal symptomatic, metronidazole. Next, ALS, drug of choice riluzole, edaravone, baclofen. Anaerobes, supradiaphragmatic, drug of choice clindamycin, infradiaphragmatic, drug of choice metronidazole. In the case of anal carcinoma, drug of choice is 5-fluorouracil plus topical mitomycin C. Upper GIT, esophagus plus stomach carcinoma, cisplatin, colorectal and anal, 5-fluorouracil. Anemia of chronic kidney disease, drug of choice darbepoetin. Next case, angioedema, allergic, drug of choice epinephrine plus minus antihistamine steroids, hereditary C1 esterase inhibitor. Next, ankylosing spondylitis, drug of choice NSAIDs, aspirin or ibuprofen or infliximab. Anevolution, hypogonadotrophic, drug of choice GnRH agonist, PCOS, letrozole, then clomiphene citrate, increased prolactinoma, bromocriptine. Aortic dissection, drug of choice beta blockers, labetalol, esmolol. If non-reactive, then IV nitroprusside. Invasive aspergillosis, drug of choice voriconazole. Continue for secondary prophylaxis. Primary prophylaxis is postconazole. Aspiration pneumonia. Post-op, drug of choice S2 blockers, control base acid secretion. Atrial fibrillation flutter, drug of choice cardioversion, treatment of choice. Iblutide, chemical conversion, and amiodarone. Long-term, rate control beta blocker, rhythm control amiodarone. Atropine toxicity, drug of choice physostigmine, crosses blood-brain barrier, also drug of choice for datura poisoning and belladonna poisoning. Atypical pneumonia, macrolides, azithromycin is a drug of choice. Autoimmune hemolytic anemia, drug of choice prednisolone plus rituximab, which is anti-CD20. Next one is the babesiosis, drug of choice etavoquone plus azithromycin. Bacterial vaginosis, metronidazole, then clindamycin. Metronidazole is a drug of choice for amoebiasis, giardiasis, and trichomoniasis. Next one, Bartonella, drug of choice doxycycline plus gentamicin or rifampicin. Rifampicin is given if gentamicin is contraindicated. Bell's palsy, drug of choice prednisolone plus valsiclovir. Benzodiazepines toxicity, drug of choice flumazenil. Next one is the belladonna poisoning, drug of choice physostigmine. Beta blocker toxicity, drug of choice glucagon, source of CAMP, bradycardia atropine, hypotension epinephrine, hyperglycemia insulin. Bipolar disorder. Drug of choice is lithium, acute mania, valproate for the faster onset than a typical antipsychotics, overall drug of choice. Bird flu, drug of choice oseltamivir, influenza AB, and zanamivir, inhalational drug. Next one is the Borrelia, drug of choice doxycycline, contraindicated in children. Children or pregnant, amoxicillin. Bradycardia, drug of choice atropine. Breast carcinoma, drug of choice ER, premenopausal tamoxifen. Postmenopausal letrozole, resistant fulvestrant, and HER2 new positive, trastuzumab, then lapatinib. Next is the brain tumor, drug of choice temozolomide. Brittle asthma, drug of choice epinephrine. Bronchial challenge test, drug of choice methacholine, synthetic acetylcholine. Bronchial asthma, inhaled corticosteroids plus lava formoterol acute. And inhaled corticosteroids for long-term persistent aspirin. Brucella, doxycycline plus rifampicin. Bruxism, drug of choice Botox. Burn infections, drug of choice topical silver sulfadiazine, also used in fungal keratomycosis. Next is the CAH, drug of choice hydrocortisone if the baby is already born, and dexamethasone fetus. Campylobacter, drug of choice azithromycin, parenteral carbapenem, and aminoglycoside. Next one, candidiasis, skin topical fluconazole, oral thrush clotrimazole, esophagitis, vagina and cystitis, oral fluconazole, systemic ivolipo, and amphotericin B, liposomal amphotericin B. Next is the carbamate poisoning, drug of choice atropine. Carcinoid syndrome, drug of choice octreotide, telostrestat. Next, carcinomatous meningitis, intrathecal methotrexate plus eucovorine, intrathecal cytarabine, add on dexamethasone. Next is the cardiac arrest, non-shockable ECG, epinephrine, amiodarone is a drug of choice. Cardiogenic shock, drug of choice norepinephrine, then dopamine. Drug of choice for the CA cervix is cisplatin. Next is the chancroid, drug of choice azithro 1 gram single dose and ciprofloxacin. Cheese reaction, phentolamine is the IV. Next is the chemo-induced nausea and vomiting for the mild ondansetron, moderate ondansetron plus aprepitant plus dexa. For the severe ondansetron, aprepitant, dexa plus olanzapine. Next one is the cholera. Drug of choice, ORS and doxycycline, then azithro or ciprofloxacin. Choriocarcinoma, drug of choice methotrexate, chlamydia, drug of choice azithro, 1 gram single dose directly, doxycycline if complicated, plus ceftriaxone. Next is chronic CHF. To decrease mortality, AC or ARB, sacubitril plus valsartan, beta blockers. Chylomicronemia, drug of choice, fibrates plus PPAR alpha, increase LPL, decrease TG. Chylothorax, drug of choice, octreotide. Next is the CLL, drug of choice, fludarabine, cyclophosphamide, and rituximab. Clonidine withdrawal hypertension, drug of choice, IV phentolamine. Next is the Clostridium difficile, most common cause third generation. Next is the Clostridium difficile, most common third generation cephalosporins, aminophenum, and fluoroquinolones. Clindamycin. Clindamycin is the most potent. Vancomycin oral, metro add-on. Doxamycin, rifaximin. CML, drug of choice, imatinib, BCR, ABL, TK inhibitor, bosutinib, nilotinib, ponatinib, amocitaxin. Coccidoidal meningitis, drug of choice, fluconazole. Cold agglutinin disease, drug of choice, rituximab plus bendamustine, bortezomib. Colorectal carcinoma, drug of choice plus phalinic acid, oxaliplatin, irinotecan. Next is the COPD inhibitors, tiotropium, drug of choice for the cough, mild to moderate codeine for the constipation, severe morphine methadone bronchial CA के लिए. Crohn's disease, mild oral budesonide, moderate severe infliximab also given for maintenance. Cryptococcal meningitis, induction liposomal amphotericin B plus 5-fluorouracil. Maintenance, fluconazole oral. Cryptosporidiasis, drug of choice, nitazoxamide, mechanism of action inhibits PFOR enzyme and paramomycin. Next, cutaneous leishmaniasis. Next is the cutaneous leishmaniasis, drug of choice, sodium stibugluconate. Cycloplegic, drug of choice, tropicamide, atropine ointment in children. Next one is the cyclosporiasis, drug of choice, cotrimoxazole, nitazoxanide, and ciprofloxacin. Cystitis, drug of choice, cotrimoxazole, nitrofurantoin, and fosfomycin. Cystinuria, drug of choice, tiopronin plus potassium citrate and acetylzolamide. CMV, drug of choice, valaganacyclovir and ganciclovir. If it is non-reactive, foscarnet. Dabigatran oral DTI, idaracizumab is the drug of choice. Datura poisoning, drug of choice, physostigmine. DVT, low molecular heparin, enoxaparin, and 10 days minimum. Next is the depression, SSRI, fluoxetine, longest acting, paroxetine, shortest acting, depression with insomnia, mirtazapine, block H1. Dermatofibrosarcoma, protuberance, imatinib. Dermatophytes, drug of choice, terbinafine plus or itraconazole. Diabetes insipidus central, drug of choice, desmopressin, nephrogenic thiazide, lithium-induced amyloid, then thiazide. Drug of choice in cisplatin is the drug of choice in upper GI CA and orogenital CA. Adverse drug effect, ototoxicity, irreversible. Most emetogenic ondansetron plus dexa plus olanzapine, nephrotoxic preload with NS plus mannitol, diuresis, chloride diuresis. In diabetes mellitus type 1, insulin pramlintide, alpha glucosidase inhibitors, acarbose. Type 2, metformin, DK, IV insulin for the regular and then aspart. Next one, digoxin toxicity, digibant, tachyarrhythmias, drug of choice, lidocaine. If it is non-reactive, amiodarone. Bradyarrhythmias, drug of choice, atropine. Diphtheria, drug of choice, erythromycin, penicillin. Erythromycin is a drug of choice for pertussis also. Next one, diphyllobathrum, Phyllobathrum latum, drug of choice, praziquantel. Praziquantel mechanism of action, increase calcium influx, spastic paralysis. Some points about the methotrexate. It is SV specific, drug of choice for choriocarcinoma, carcinomatous meningitis, osteosarcoma, rheumatic arthritis, psoriatic arthritis, GVHD, ectopic pregnancy, and side effects bone marrow suppression. If there is bone marrow suppression, then give leucovorin or folic acid. It is hepatotoxic long term if used long term, and cystinuria. Give bicarbonate diuresis. Next, epilepsy, drug of choice for the generalized tonic-clonic seizures, valproate. For GME, drug of choice valproate. Absence seizures, typical ethosuximide, then valproate, atypical valproate. Partial seizures, drug of choice carbamazepine, lamotrigine. Mixed seizures, give drug of choice valproate. Infantile spasm, without TS, ACTH, with TS, vigabatrin. West syndrome, drug of choice ACTH. West syndrome में क्या होता है? Slam scissors. Neonatal scissors, drug of choice phenobarbital. Pregnancy scissors, levetiracetam, then lamotrigine. Status epilepticus, drug of choice lorazepam. Few one-liners about the capecitabine. It is oral drug. 5-fluorouracil is IV. Drug of choice for colorectal carcinoma and anal carcinoma, and side effect is hand foot syndrome. Next is the essential thrombocythemia, drug of choice hydroxyurea plus aspirin. Hydroxyurea inhibits ribonucleotide reductase RNR. Essential tremors, drug of choice propranolol, primodine, gabapentin, topiramate, and nimodipine. Topiramate is given for migraine prophylaxis and treating obesity. Next is the ethyl glycol poisoning, drug of choice fomepizole, complementary inhibition of AC dehydrogenase. Next disease is the familial Mediterranean fever, drug of choice colchicine. It inhibits microtubules. Fibrinolytic toxicity, drug of choice EACA, then tranexamic acid. EACA inhibits plasmin. Next, 6-thioguanine. It is purine analog. Treatment for leukemia. Side effects bone marrow suppression, hepatotoxicity decreased by 75% if given with allopurinol. Next is filariasis. Drug of choice DEC plus albendazole plus ivermectin. Fungal corneal ulcer, drug of choice natamycin. Gas gangrene, drug of choice penicillin G plus clindamycin. Clindamycin inhibit protein synthesis. Gastric carcinoma, drug of choice cisplatin plus 5-fluorouracil. Genital warts, drug of choice for male podophylotoxin and female imiquimod. Next drug is cytarabine. It is continuous IV infusion, also cladribine. Treatment for AML, donorubicin. Side effects neurotoxicity, cerebral toxicity, and cerebral toxicity. Cerebellar and cerebral, both toxicity. Next disease, drug of choice PPI, pregnancy antacids plus sucralfate and lansoprazole. Next disease is the giardiasis, drug of choice metronidazole and etozoxanide. Next disease GIST, drug of choice imatinib, sunitinib, and regorafenib. Glaucoma, drug of choice acute congestive glaucoma, mannitol, then acetazolamide, and then pilocarpine. Open angle glaucoma, prostaglandins, beta blockers. Glauconoma octreotide is the drug of choice. Trastuzumab treatment for HER2 positive breast cancer, gastric cancer. Side effect cardiotoxic, HER2 TK negative, lapatinib. Next is the gonorrhea, drug of choice ceftriaxone, add azithromycin or doxycycline. Next one is the gout. For the acute indomethacin, then colchicine steroids. Chronic allopurinol. Allopurinol is an uricosuric agent. Hypersensitivity to allopurinol, give oxypurinol. Next one is the granuloma inguinale. Drug of choice doxycycline, cotrimoxazole, and azithromycin. Next disease, Graves' disease, drug of choice methimazole. Primary treatment propylthiouracil, which is hepatotoxic. Hairy cell leukemia, drug of choice cladribine, then pentostatin, consolidation rituximab.